everybody. Today I'm going to talk about the topics scope of mental health nursing. Okay, then we have the current trends and issues in mental health nursing as well as the factors affecting the level of the practice. So these are some topics which are important. So nowadays, as you know, that there are many cases of mentally ill clients, and it is necessary that the nurse should be updated about the current issues or the current trends which are in the healthcare department. So, as a nurse, it is important to know the level of nursing practice is not only limited to the bedside nursing care, but also the various opportunities that a nurse has in different roles for delivering the care services. So, first we will see about the scope of mental health nursing. So, very important the scope. The scope is nothing but it tells us what is the opportunities the nurse has, a mental health nurse has for delivering the care services. Incidence and prevalence of the mental disorders. There are wide range of action and potential health problems which we can see in the community, from the various stress disorders or the disorders which occur due to the crisis, or we can see the emotional disorders. Then we have developmental disorders and also certain disorders which are having physical symptoms due to psychological problems. So the wide range of the mental health problems are there in the world or in the community, which is giving the opportunity for a nurse to not only limit our care delivery in the bedside care, but also as a community in a whole. So, as a nurse, she is not restricted within the confines of the bedside nursing care, as I told, but also the overall different roles that she can possess. Yes, a mental health nurse needs to be skilled and clinically competent, sensitive to social environment. So if you take the qualities of a mental health nurse, how a mental health nurse should be, she should be clinically competent and skilled. Okay, she has to know what are the skills for delivering the care for mentally ill patients, especially when it comes to the patients with mental illness. That very important. She has to know how to interact with the patient, how to communicate, how to deliver the care services to the client, and also she should be sensitive to the social environment. Okay, she has to know what are the changes which is happening in the society, in the community. She has to know what are the services which are available for the mentally ill clients, or what are the supportive environment for the mentally ill clients when she's delivering the care. She has to be aware about the advocacy needs of the client and their families. So, as you know, the earlier days, the rights of mentally ill patients were not been given much importance. But nowadays, very much important. As a nurse, she has to carry out the role as an advocate to understand what are the rights of mentally ill clients as well as their family, and deliver the care accordingly. Right, she has to be aware about the legal and ethical issues or dilemmas when she is delivering the care. So these are the various we can see the areas wherein the nurse has to work now at the present scenario, as there are a lot of changes which is happening in the society. Yes, so we'll see what are those trends and issues in mental health nursing. So we have the history. If you take the history of the mental disorders, so if you take the history how the mentally ill people were treated, right? So they were changed, they were isolated, they were beaten up, they were burnt alive. So all such cruel acts were put on a mentally ill client. So as the people started growing up or developing the quest for the knowledge, to understand the truth. So now it's very, very important that the mentally ill clients are not only should not only stay in an institution for receiving the care, but also they can be sent to the community or to their family back once they are better, right? So it becomes an important role that in the earlier ages that they were sent to the particular institutions or mental hospitals for receiving the care. But now, since there is a lot of changes, that is, there is a globalization, the process of deinstitutionalization is going on, right? That is, when a mentally ill client is assessed, if the psychiatrist feels that the illness can be managed at home or in a particular community, it is not necessary to send the patient to a mental institution for the treatment. So he or she can be sent back to the community for the treatment. Particular community, they can be given the treatment. So from the historical period of institutionalization, now it is moved to the deinstitutionalization. We have many drugs which are helpful for treatment of mental disorders, the psychotropic drugs nowadays, which are advanced and which will help in curing the mental illness. So, how do we integrate with the mental health community? So, to integrate with the community, mental health community, it's very much important according to Leninger. So, the experience and education plays a very important role. So, as a nurse, she has to be well educated, she has to be well qualified, and she should have the skills and experience in dealing with the community. Not only that, she is functioning in various setting as different roles. She can be a psychiatrist, registered nurse, or advocate, or a nurse manager. She has got various roles and functions that she can carry out in dealing with the mental health community, and the relationship with the other professions that she has to maintain when she is communicating. It can be it can be with the psychiatrist or with the psychotherapist, or it can be social worker. She will deliberately collaborate with the other healthcare team members when she is giving the care to the client in a community. So very, very important that she has got the experience and she's well educated, and she's got the various roles and functions, and also that she is having the relationship with the and she's having the professional relationship with the other professions, right? So if you take the present scene or the present scenario of the mental health, so we can see that 450 million people are affected worldwide with the mental problems. So mental problems are common in all the countries. We cannot say this particular country is having patients with people with more mental disorders. No, it's equally distributed if you take in the all the countries, and 1 in every 4 persons going to the health service has at least one emotional problem. So if you take every person who visits the healthcare department, mental health centers, we can see at least one emotional disorder in each and every person. Mental problems of clients with the chronic disorders also can be seen. So people who are chronically suffering with the mental disorders can also be noticed in the mental health care. Unavailability of the cost effective care is another scene that we can see in the mental health field. So we haven't got the various treatment modes which are cost effective even for all the group of the population. Lack of recognition and awareness as well as the action. So there is a lack of recognition of the mental disorders in the community, the awareness about mental disorders in the community, and how to go about if there is a person with mental disorders in the community. What action should be taken? So the awareness is lacking related to the recognition and awareness and the action for the mental disorder. So this is a present scenario, the scene that you can see in a mental health setup. So what are those issues around the mental health nursing? So if you take particularly the mental health nursing, so what are those issues which is around the mental health nursing? It's very hard to justify scientifically due to the lack of research results. So we have very few research studies in nursing if you take. So we don't have much scientifically proven results to support the services what we deliver. The role differentiation based on education and experience is unclear. So based on the education and the experience what a nurse has, the different roles what can be given to a nurse is still not differentiated, even though she is done her masters or a doctorate degree in nursing, or she's specialized in a particular area. She's got a lot of experiences in the specialized area. Even though that she's having a good education and experience, she's not been recognized or given a specific role for independent functioning. So that is a very important here in the issue in the mental health nursing. So she is not given the proper role and function responsibility according to the education or the experience, right? So to become, another thing is to become a psychiatric nurse is not an option for the students. Why students are not opting to become a psychiatric nurse? That is another important issue which is happening. Okay, maybe the students are not being given the complete knowledge about particular field or specialty, or they would have not been given an opportunity to get the clinical competence or the clinical skills in mental health nursing. Because of the lack of knowledge and skill, they may not feel confident to enter into the psychiatric nursing field. Yeah, these are some of the things which are happening in the field of mental health nursing, the issues which are related, right? Moving on to the changes and the challenges. So what are those changes and challenges in the mental health field? So we have got the various changes which has happened. Okay, so we have the demographic change, the social change, the economic changes, technological changes, as well as mental health care changes. So first we will see the demographic changes. So if you take the demography or the people, okay, so we can say that nowadays there is an increase in the number of elderly people. So why there is an increase in number of elderly people? So earlier, if you would have seen, the mortality rate were quite high. Okay, so but nowadays, because of the new technology or because of various advancement in the medical field, even the lifespan of a person is increased. So there is an increase in the number of elderly people. There is a life expectancy of the person is increased. So number of elderly people is quite high. Okay, so when such a thing is there, the elderly group of population are very much vulnerable for the mental disorders. So even though they are having a good life span, but still they are ending up with the mental disorders, right? It can be depression, it can be the crisis which can happen, or it can be the various abuses that elderly will undergo during their time. So these are some of those mental health disorders that can affect, or even we have dementia, right? So all these things can be there with the elderly patient. So very much important. These are the challenge that an elderly person has to face. Their own pros and cons staying in a joint family or in a nuclear family. So nowadays we have more nuclear families. So when there is more nuclear families in the community, right? So there may be many health issues or relationship problems in the nuclear family too. Say for example, there is a father and mother, there are children in the nuclear family. Maybe at times when it becomes difficult for them to manage, there won't be enough supervision for the children, maybe because the parents are going for work, they are tired, they are stressed, okay, and there no supervision onto children, or they are the parents, if you take, they may be very much stressed or emotionally depressed because of the same routine which is happening. Or children, if you take, they don't have the recreational activities, how earlier the children used to go out and play, right, outdoor games. But nowadays, children are confined to their cell phones, the television, or the mobile gadgets, right, which can cause mental disorders in the children. There's no other way, because they have to be busy in some or the other way. So the whole family can be affected with the mental disorder, since there is more nuclear family. The second one is a social change. So what is this social change? So in the society, what are the changes which is happening? Peer pressure, right? So peer pressure is another thing wherein the adolescent who is there in a particular wants to identify himself in that group, right? So at times he may enter into certain practices or certain activities which is not accepted by the society. He may end up with the negative impacts, like becoming a drug addict or alcoholic, or involving in various abuses of the drugs. So because of the pressure of the peer to identify himself in the group, okay, he has to practice, or he has to enter into such kind of the activities which can lead to mental disorders. The third one is the economic changes. So you know very well there are changes in the economy, in the industrialization, urbanization, and the raised standard of living. So all these things which is happening, it's contributing to the economic changes. So because of these, there are changes in the financial aspects. If you take the individual or the family, they are stressed financially to reach the particular standard of living, to reach the particular stage of living. It can be related to urbanization. Can People are coming from the rural areas to the urban community, in view of getting various job opportunities. And also, if you take the standard of living in the urban community, the people try to compete themselves economically. So all these competitions which can cause a stress in the individual and can lead to the mental disorders. So next thing, the fourth one is a technological change. So very rapidly that there is a change in the technology, the influence of the mass media, right? So we have a lot of social medias which are having an impact on the individual's personality, right? So we have electronic systems which are using the gadgets and the information technology, make the use of this particular technology, right? So nowadays you can see that young people or the adolescent group, so they are more attached to the technology, they are more attached to the gadgets. So there are many applications wherein they start using, so they may enter accidentally into certain things which are not necessary for them. So they may end up with a lot of involving themselves in such kind of activities which is going to cause a harm to a person, right? They may end up with the mental disorders, right? So next is the mental health care changes. So what are the changes in the mental health care department? So there is an increased awareness about the mental health disorders, right? It's not like previously that people didn't have much awareness. They were thinking that the person used to behave in an abnormal way because of the evil spirit or demons in him. But nowadays, as the science is improving, we have got the the responsibility as a nurse to create an awareness in the community, and as a result, even the community nowadays are well aware about the mental disorders and what is the treatment, what to whom they have to approach. So all these are information that the public is having. So it becomes very demanding from the consumer or from the client point of view, that is not the quantity of the care they require, but the quality of care that they want, right? So they are very well aware about the mental disorders. There is increased mental health problems. So, because of industrialization, urbanization, the use of technology, so all these things are contributing to the increase in number of mental disorders. So all these directly or indirectly is affecting the individual's life. It can be the personal life, the relationship problems, the various emotional disorders. All these are being seen in the individual nowadays, and as a result we can see many mental disorders. So this is about some of the challenges or the changes which is happening in the community or in the world, which is causing a very important impact on the health of the individual. So we'll see what are those current trends in mental health care. So what are the trends in the mental health care? First thing is the educational program. So we have numerous educational programs for a psychiatric nurse. So what are those educational programs for psychiatric nurse? So she can do a diploma in the psychiatric nursing. Once she completes her education as a general nurse and a midwife, or if she has completed a BSc nursing, she can take up a diploma course. If she is interested to work in a psychiatric setup, she can take up a diploma course in the field of psychiatric nursing. So it's a trend that has there right now, and it is being started in Nimans from the year 1956. So MSc program in psychiatric nursing also is another option. The masters and specialization in the psychiatric nursing. Initially, it was started in RAK College in the year 1976. MPhil in psychiatric nursing started in the MG University, Kottayam in the year 1990. So we have got the doctorate programs in psychiatric nursing. So in the various institutions and universities, so we have a national consortium PhD in psychiatric nursing under RGHS, Rajiv Gandhi University of Health Sciences. Also, we have it in Mahi, Manipal, Nimhans, Bangalore, and RAK College in the Delhi. So these are the various education programs which are related to the psychiatric nursing. So the next one is development of code of ethics. So what is this development of code of ethics? As a nurse, that where there are various roles in for a psychiatric nurse. So she may have to work in the psychotherapy or behavior therapy or various group or family therapy. She has to be an important person who will be collaborating between the various mental health professionals. So as a nurse, she has to know what are those rights of the client, the family, as well as the community as a whole, and she also has to know how to maintain the patient's confidentiality, which is very much important. She has to become a nurse advocate when she is delivering the care. This next one is the legal aspect in psychiatric nursing. So what are those legal aspects? It's nothing but which is related to certain laws or acts which a nurse has to follow when she is delivering the care. So legalities, like when she is delivering the treatment, that she has to know what are the rights of the patient. If the patient is rejecting the treatment, yes, the nurse has to take it into note, and she has to consider the client. And also, she should be able to protect the patient from confinement. She has to take an informed consent, avoid the intentional thoughts, confidentiality of the client should be maintained, and record keeping. So in all these areas, very much important that the nurse should know the laws or the legal aspects related to psychiatric nursing. The next one is the promotion of research in mental health nursing. If you take a nursing, we have got very few research studies to support our practices. So, as a mental health nurse, it's very much important that she takes up the innovative methods or innovation to collaborate with the theory and the practice, and also she should be a very important person to participate in the research activities. So, promotion of research in mental health is a very important and vital thing that we as a nurses should participate and become an important person to support the delivery of the care. Next is a cost effective nursing care. What is this cost effective nursing care? It is the viability in terms of cost involved in training the mental health nurse and also the quality output. A viable part for any individual to take up the particular nursing course. Yeah, it should be cost effective, and also she has to undergo such a training that she has to give a quality output or a quality care. Right. So next is the focus of care. So what is the focus of care? So we have got the target groups which require the care compared to the other groups. Like, what are those target groups in the mental health nursing? So we have got the elderly group of population, the children, women, youth, mental retarded children, and the chronic mentally ill individuals. So all these group require special consideration and the concentration to identify the cases in this group and to deliver the care time to time, so that they may not end up with the severity. Right. So this is about certain trends which is happening in the mental health care. Okay, based on this, we have got new trends in the role of psychiatric nurse. So, as the society is changing and as the expectation of the society is changing, the people are well aware about the mental disorders, the treatment options. Even it is important that as a nurse, she has to be well prepared to deliver the quality care. So, based on the knowledge or based on the education and the experiences, we can say the nurse has got different roles to play. Okay, so she can play a role in the primary mental health care, and she can collaborate with the psychiatric nursing practices. She can become a clinical nurse specialist, a nurse psychotherapist, psychiatric nurse educator, psychosocial rehabilitation nursing, child psychiatric nursing, gerontological and geriatric nursing, de-addiction nursing, neuropsychiatric nursing, and community mental health nursing. So these are the various fields that a nurse can get in. Completed a psychiatric nursing program, so she can get into any of these areas of her interest, and she can learn and get the skills how to deal with such kind of the clients, and she can specially play a specialized role in the particular area of interest. So based on the needs of the society, even the roles of a nurse is changed from not only being a bedside nursing care staff, but also the various responsibilities of a nurse that we can see. Right. So, what are those factors which are affecting the nursing practice? So, yeah, in spite of all the trends or the issues and in spite of all the issues and the new trends that we have got, the new rules as a nurse that we have got, there are some factors which are affecting the delivery of the nursing practice, the level of nursing practice. So, we have the first one, which is the Nurse Practice Acts. What are these Nurse Practice Acts? These are the acts or the laws which regulate the nurse to enter into a profession. So she has to be registered in a particular regulatory body. Only if she is registered in a particular regulatory body, she will be able to carry out a job responsibility. So she must have a nurse practice act or the legality that she is being a registered nurse in a particular regulatory body to practice her profession. Yeah, next thing is a professional practice standard. So it counts the practice of nursing in the various setting. It gives us the standards, and also it counts us what kind of a practice that we have to carry out. The next thing is educational qualification and experience. So the nurse should have a basic educational qualification. It can be a graduate program, and also she should be well experienced and skilled in a particular field too. And she also has to have a certification status of about a particular qualification. It's not only getting a degree, but she should have the knowledge, well-versed knowledge, and the skills, as well as the certificate to carry out a profession. The healthcare organization's philosophy, very, very important, that the nurse should practice a profession based on the organization's philosophy. Each healthcare organization has got its own philosophy. So as a nurse, very much important that she has to reach the organization's goal or vision whenever she is practicing a particular delivering of the whenever she is practicing the nursing. So the next one is the self motivation and personal initiatives. Very much important that whatever we want to be, it is our wish and it is our passion that we are putting in even in our service, right? So a nurse should be well competent enough, and she should be enough. She should be a person who has to motivate herself. It can be related to higher education. It can be related to entering into a new role. It can be the knowledge about herself. Okay, well, the self awareness very, very important to understand the strengths and weaknesses of a person. And also when she understands herself and she is able to motivate herself, even the delivery or the quality of care what she can give can also be improvised here. So this is about the self motivation and personal initiatives that a nurse should have when she is practicing the nursing profession. So this is about the factors which are influencing or which are affecting the level of the nursing practice, right? So today you have learned about the scope of nursing. It's not limited only to bedside. She's got various roles and functions and responsibilities that she can carry out. What are the current issues, the presently the scenario which is there in our country and in the field of mental health nursing? So what are those trends that a nurse has, the various opportunities that she has the field to work, and also what are the factors which are affecting the level of nursing practice. Hope you all have understood the topic. Thank you so much.